Nurse practitioners blend traditional medicine with traditional nursing to create something non-traditional. So the first need that nurse practitioners fulfilled was being a care provider that could take care. They started out with children, and so that's how it evolved. And so it was the shortage of physicians that drove this movement. And but it went beyond that. Nurse practitioners started filling roles that physicians didn't fill in terms of care coordination at a higher level, but still managing the medication, the diagnoses and such. The other part of nursing that was brought into the nurse practitioner role was the home experiences. And so the nurse practitioner already knows what goes on in homes when they move into that provider role. And so that's another one of the needs, the shortage, and then to bring nursing into that. And the nurse practitioner, by way of their being a nurse, are very directed toward patient teaching. They've designed ways that they can educate the patient during the encounter or with materials afterwards or follow up in the home and so on. So the education is a very big, this is care coordination, education, holistic approach to the patient. The basics of nursing stays the same. We're based on ethics. We're the highest ranked in ethics of all professions by the Gallup poll every year, in trust. And so that will never change. But the roles have changed as we've received more education. And we're more evidence-based in nursing and all of healthcare. And it's more that we have technology to keep ourselves very current on everything, then our practice has advanced. And at one time, nurses weren't even allowed to use a stethoscope. For that matter, they didn't even use a thermometer. And we've come light years that now nurses are hospitalists. It is very much more high-tech than ever before. But with that, we bring the high touch. The nation has not yet completed its job of removing the barriers to practice for nurse practitioners and other APRNs in this nation. So that's our challenge, is to help our state see that nurse practitioners can do even more. There are studies to show that once you get full scope, you have better outcomes and less expensive care. Full scope means that the nurse practitioner will not have barriers to perform in the way that they were taught. The idea is to make sure that there's access to health care, whether it's a nurse practitioner, physician, or whoever, PA, the physician's assistant, but so that nobody is going without health care because of a shortage of providers.